In this segment, we're talking about the 3 most common types of hip pain. And when I say types, that does not mean the cause, but what I'm talking about is the diagnoses. We're really going to try to talk about ways that we can relieve pain during movement so you can get back to all those activities that you love and that you need to do in order to have a happy life. And we want to do that by avoiding medications, injections, and surgery. So number 1 most common type or most popular diagnosis of hip pain is osteoarthritis. So osteoarthritis is diagnosed using an X-ray. And what the radiologist is looking for is they're measuring the space, the joint space, between the head of the femur and the socket of the pelvis. Number 2 most common type or diagnosis of hip pain is called hip bursitis. As you can see on this image here, hip bursitis or a bursa is a fluid-filled sac. We actually have them throughout our entire body. Their function is to be between, so a muscle turns into a tendon and the tendon attaches to a bone. And the fluid-filled sac called the bursa is actually underneath the tendon, and it's designed to lubricate that tendon so when it's rubbing on the bone, it doesn't fray the tendon. So it's kind of a cool design if you think about it. But when the tendon rubs too much, there's too much motion and friction in an area, the hip, that bursa starts to get inflamed. So the friction causes inflammation, and then we get bursitis, so inflammation of that fluid-filled sac. Common symptoms of hip bursitis are I have pain in my hip when I lay on my side. So very, very common, yet undetectable on an image. So we're not seeing that on an X-ray, but yet there's a really easy test. The test is actually just, if you can push on the side of your hip and you can find a sore spot, that is hip bursitis. If it's the joint, you're not feeling that by just pushing on it. It's much deeper. The 3rd most common type of hip pain is called a labral tear. And so a labral tear is, if you look at the socket of the hip, so the ball goes in the socket, around that socket there's a cartilage ring. And that cartilage ring is designed to give the hip a deeper socket so that there's more stability in the hip joint, because there's a lot of forces that go through the hip. If that ring gets a tear in it, that again is picked up on an MRI, and then we are labeled that we have a labral tear. Studies are indicating that a large amount of people who have a labral tear in their hip also have no pain. So a labral tear does not mean that's actually the cause of pain. It just means that we picked it up on an image, we've been diagnosed with it, but 69% of people over the age of 60 have a labral tear in their hip without pain. In fact, I have a labral tear in my hip and I have no pain. We're going to talk about the 3 big areas of the body that are contributing to stress in the hip. And usually this is movement stress, so it's friction or pressure or forces that are going through the joints, the soft tissues, ligaments, tendons, muscles. All those things are getting stressed from excessive movement. And so let's talk about the number 1 most common cause of hip pain right now. It's actually the hips, which is kind of funny. There are many factors that make that joint space narrow, not just arthritis or aging. In fact, more commonly, it's the muscles around the hip that get tight. So there's a lot of muscles around the hip, many muscles. We're not going to talk about all of them, but let's just say all of them actually. If they're restricted in flexibility, they can actually compress the joint and cause that image to show joint space narrowing. Number 2 most common cause is actually the foot and ankle. The foot and ankle have a huge influence on what the hips are doing. In fact, I can't move my foot and ankle when I'm standing on the ground or walking upright. I cannot move my foot and ankle without moving my hip. And vice versa, I can't move my hip without motion occurring in my foot. So they're interconnected. So let's talk about 2 common things that happen with the foot. So you're all familiar with the foot flattening out like a pancake. When the foot flattens out like a pancake, that motion grabs onto the lower leg bone and it turns the entire leg inward about 30 degrees. So that means the knee turns in 30 degrees and the hip turns in 30 degrees. Now, if I have excessive motion in my foot and ankle, it's turning in too much. It's unstable. It turns in too much. It's going to cause the hip to turn in more than what it's designed to turn in. And again, if I take any joint in the body and move it beyond its limit, it's going to start to cause stress overloading the tissues, damage, which then triggers the healing process, which again, inflammation becomes part of that, and pain. So again, foot turning in too much can be a problem. Now, the foot also can have a problem where it doesn't turn in at all. So that's kind of more like my problem. If you have really high arches and a stiff, rigid foot, when the foot turns or flattens out like a pancake, we talked about how it turns the leg in. Well, that's actually valuable. We want the leg to turn in 30 degrees because it activates the muscles in the hip. You see, muscles, when you're not thinking about them, they're just reacting to movement. And in this case, when the hip turns in, the muscles get lengthened. And those muscles, when they get lengthened, turn on and say, oh, I need to control that motion. If I don't have any foot flattening out at all, that can inhibit our hip muscles, which again is going to cause the forces are still transmitted through our foot to our knee to our hip, and they're supposed to continue to the top of our body and leave the body, gravity and ground reaction forces. And if I don't have hip strength, I'm going to overload the tissues in the hip and I'm going to have damage. So the foot and ankle is really important to successful pain-free hips. So you should be asking yourself, has anybody looked at my feet in order to find a solution for my hip pain? Probably not. The third most common area or cause of the hips being painful is actually found in our upper spine. So how our upper torso is moving. And again, that goes back to the concept that when muscles get lengthened, they become strong. So they load. You load those muscles and they build up energy and they become strong. When we are turning our upper body, let's say when we're walking, that turn of the upper body actually lengthens the butt muscles. And that gives us then strength in the hip. So without motion in my upper body, we're going to have a problem in those hip muscle being strong. If you can remember, previously in the show, we talked about hip pain, osteoarthritis being the most common diagnosis. And we really spent a lot of time talking about joint space, the joint space being decreased. Well, the best way to increase joint space is to move the hip. The hip is a ball and socket joint. So we know the hip is designed to move front to back, side to side, and rotate left and right. And there's a really simple strategy we can do to get the hip to move in all 6 directions, which will get the hip to have more joint space, more mobility. So real quick here, I'm going to show you the easiest strategy that you can try at home that will offer some hip joint space increasing and decreasing some pain. So we're going to pretend like my right hip is the hip, it actually is the hip that needs a little bit of mobility in the joint. And so we're going to start out by moving the hip joint front to back. You're going to take your left leg and you're going to step forward and you're going to step back. Okay, you're just keeping your right foot glued to the ground. So you're just simply stepping front to back, keeping your right foot glued to the ground. I usually do about 10 to 15 of these motions. Then the second motion is going to get the hip to move side to side. So you're going to take the left foot and you're going to step to the side and then cross the foot over. Step to the side and cross over. You might even feel a little tension in the inner thigh when you step this way and a little tension on the outer hip when you step this way. If your balance is challenged during this activity, just hold on to something. Go by a wall or a doorway or a chair or grab a cane, whatever you need to do to be safe. And then finally, the third motion is getting the hip to rotate. You're going to, again, keep that right foot planted on the ground. Take your left foot and you're going to rotate across the body and then rotate back. Again, keeping the right foot planted on the ground. This is going to provide a nice, easy glide in the hip joint. And if we do these every day, we will get more hip mobility, more joint space,